From April to September, ultraviolet radiation, which causes damage to your skin, is strong enough to cause DNA damage and increase your risk of skin cancer. So it's important that for those 6 months from April to September that you follow the SunSmart 5 S's and protect your skin from the sun's radiation.
Hello and welcome to the HSE Talking Health and Wellbeing podcast. Today we're going to be talking about the SunSmart campaign and how we can prevent skin cancer. Our guest speakers are Dr. Breda Neville, specialist in public health medicine, and she works in the HSE's National Cancer Control Programme and chairs the implementation group for the National Skin Cancer Prevention Plan. And we're also joined by Bernie Rice, who is a skin cancer prevention campaigner. Bernie is also on the implementation group, and she is a public representative. And one of the main reasons that Bernie is here today with us and is doing all of this amazing work that she's doing, her beautiful daughter Sharon died in 2008 at the age of 33, following a 2-year battle with melanoma skin cancer. So Bernie will tell us a little bit about Sharon's story in a while. So first of all, ladies, thank you very much for joining me today.
You're welcome.
Breda, you're the public health expert, and this is a really difficult subject, and especially with Bernie here and what happened to Sharon. But skin cancer, what is skin cancer and what causes it?
Skin cancer can be categorised into 2 main categories. So there's melanoma skin cancer and non-melanoma skin cancer. Non-melanoma skin cancer is by far the commonest, so it accounts for about 90%, so around 9 out of 10 of all skin cancers, and around 28% of all cancers that are diagnosed in Ireland in total. So around a third of all cancers that are diagnosed in Ireland are non-melanoma skin cancers. So that's, as you can imagine, that's quite a large number. The 2 commonest types, there are many types of non-melanoma skin cancer, but the 2 commonest types really are basal cell carcinoma and squamous cell carcinoma. So basal cell carcinomas don't tend to spread locally. Now, they can be what we describe as locally destructive. So in the area where the cancer is actually located, it can damage the tissues in that area if it's not treated. Squamous cell carcinoma, they rarely spread, but on occasion they do, and it's usually to the lymph nodes. So then the other type of skin cancer is melanoma skin cancer. So melanoma skin cancer is the most serious type of skin cancer, and that's the one that we're particularly worried about. It's very treatable if you get it in time. But if the diagnosis is delayed, it can spread to other parts of the body, and that can make it very difficult to treat, unfortunately.
Okay. And Bernie, I know that Sharon had melanoma, so maybe this would be a good time for you to tell us a little bit about Sharon and what happened to Sharon.
Okay, so I have to go back now to 2006 when she was first diagnosed. And like that, Sharon was only a young girl. She was 31 at the time. And she was a busy girl, like she had her career. And the first time actually that I knew about this, it was a changed mole on her leg, was when she had called in to see me. And she said, I'm going to take a visit around to our local GP. And I said, oh, right, okay, what's about? And she said, I have this mole on my leg and it has changed. And I had a look at it and I said, oh, right, okay, just get it checked up again. But I thought nothing more of it because I wasn't aware about the implications of what was happening. So Sharon, anyway, I visited her GP and she was straight away referred to a dermatologist in St. James's Hospital. And that was within a short time. So we were very lucky with that. And when she visited the dermatologist, he said, yeah, we'll have to take that away. And he had arranged then for a procedure to happen. And a biopsy was done. And unfortunately, it came back that it was malignant melanoma and that she had to have further treatment. So Sharon had her operation and she'd one operation and she came through that. And then with melanoma, it's a surrounding skin that has to be cleared as well. So there's a fair bit around that. And she was told she may have to have a skin graft. But lucky enough, she actually didn't have to have it in the end, or they didn't go with it. And Sharon made a really good recovery after that. And of course, looking forward to getting on with her life, Then she had planned her wedding, which happened in 2007. So she was a Midsummer Days bride. Fantastic time. We had great preparations for the wedding and that. and she was doing really well. And then we had the wedding, and in November she'd moved into our new house. So all was going really, really well. And then Sharon became unwell again. And when she had visited her doctor, they said that she'd have to have a scan because of the history with the melanoma. And we were told that it had actually travelled to her lymph nodes and that surgery would have to be performed again. So she had the surgery, and she came through the surgery again, and she was good for a bit. And then she became unwell again, and she had to go and get other scans, and it had travelled again. So it was a silent travelling, because in between she was feeling so good, when it started attacking some of the organs, which we know now that is what melanoma is and what it does. She got checked up again, and we went to our oncologist, and the news wasn't good at all. And I can clearly remember the day. It was so, so sad, because I knew this was really getting to be serious, really serious than we had thought. And quite honestly, I cried, because I knew this was something really serious was happening. And Sharon did too. And her oncologist then advised her maybe to have the clinical trial, which was at the time. And she said, yes, you go forward. And unfortunately, that same day we went home from the hospital, Sharon took ill, and we had to get an emergency ambulance into St. James's Hospital. And she was extremely sick. And it was extremely hard for me to see your own daughter there, lying there, and you can't do anything, because they had to stabilise her before they could do anything. So that afternoon, it's so vivid, like still there. And this is the hard thing about, when you see someone, your precious, child going through something like this. We eventually got to St. James's Hospital, and we were told there was little hope, that it had perforated her liver, and they didn't see Sharon pulling through. And I kind of thought, no, I couldn't see Sharon going then that time. And I thought, no, this can't be happening. And they operated and took the kidney away. And it was keyhole surgery. And Sharon then remained in St. James's Hospital for 2 weeks. And they were extremely so good to us, because they gave us a room to stay within that 2 weeks. So we were with her every so often. Now, at this point, of course, she was only 7 months married. So her husband, we used to step in there to give him a break and whatnot, but he would be there quite a bit. And then one of the days when we went in to see her and sit beside her, she said that the palliative team had called. And this was something kind of, you don't want to hear. It was reality, but we didn't want to hear that, and neither did Sharon, because she actually spoke to me during the day when we'd be sitting there, and she'd say, when I get well again, I'm going to do an awareness campaign about this disease. And we'd agree, absolutely, we'll do something about it. And on the second week that Sharon was in hospital, she was to come out on the Saturday. And I was all set then to look after her. I'd given up work. And Sharon became extremely ill. And we were all there. And that was the 1st of February 2008. And 6 o'clock in the morning, on the 2nd of February, Sharon passed away.
Bernie, thank you so much for sharing that. I think the reality of that and that journey, and for our listeners to realise that that is what melanoma can do.
I would see melanoma as a silent killer.
Yeah.
Because you don't know. You see it, you can see what's on whatever part of the body it is there, but it's what's going on within the body. And that's why the awareness campaign, which we started up about a couple of months after Sharon's passing, and we have never tired of doing the awareness campaign, because it's so important.
You've been doing this for a long time now, since 2008, and I think that it's people like you that do all of this work behind the scenes, and to be able to share your story. And I can see, even after all these years, it's not an easy story to share, that your beautiful daughter, 7 months married, it's not an easy one. And I really appreciate you being here today.
Yeah.
It's heartbreaking, it really is.
It is because you say through the years, like, when you think 2008, 16 years now,
Yeah.
and it's still as vivid as, the day when it happened. Like,
I know.
So. And she was an eldest girl. She was the eldest of 4
Oh.
girls, and a brother she had as well. So,
yeah. And the journey that they've been on, I'm sure, since she died too, hasn't been easy. And your husband as well is very involved with, you've set up a trust.
Yes, a melanoma trust we set up that time. It was a case of really having to, and like Sharon would have been doing what I'm doing now.
Yeah.
I'm actually just doing this for Sharon.
Yeah.
Because it would have been her probably sitting here doing the awareness.
Yeah. Well, you're doing an amazing job, and thank you. I'm going to give you a couple of minutes after telling us that. So, Breda, that's the reality of what melanoma is doing in Ireland and in every country around the world, I suppose. And I know that we have this SunSmart campaign that started about 5 years ago. So do you want to tell us a little bit about the SunSmart campaign and what people can do to reduce getting skin cancer, getting melanoma?
So I suppose the good news about skin cancer is that it's very much, almost entirely preventable, not completely, but it's one of the most preventable cancers. So the SunSmart campaign is a public awareness campaign. It's run by ourselves in the HSE's National Cancer Control Programme in collaboration with Healthy Ireland. It runs every year between April and September. And its aim really is to raise awareness of what people can do to protect their skin and reduce their risk of developing skin cancer. So what we recommend is that people follow the 5 S's of the SunSmart campaign. So the 5 S's are slip-on clothing. So cover as much of your skin as you can, wear long sleeves, collared shirts, long-legged trousers. And what you're looking for is closely woven fabric.
Okay.
Loose but closely woven. So if you hold it up to the light and you can see through it, then the fabric it's not closely woven enough. So if you hold it up, you don't want to be able to see through it in the sunlight. And also a lot of clothing now has a UPF rating on it. So what you're looking for ideally is UPF 50.
So clothes have a UPF rating?
Yeah. So you'll see it on on sun hats or kind of swimwear or clothes that are I suppose, designed for sun exposure. They often have a UPF rating on them.
And Bernie, did you want to say something about that?
Yeah, I just said that's the ultraviolet protection factor.
Okay.
And which you can get it now, in the shops now for children. And you see, generally, it probably comes within about a 40 block. But like the swimsuits, swim hats, etc., is available now.
So could you compare it then to the sun cream that you say 40 block? Is it like wearing a 40 block sun cream? But we recommend you wear the sun cream as well, obviously. But
well, we do, but we your first line of protection should be clothing, actually.
Right.
So covering your skin is better than using sunblock. So you should apply sunscreen where you can't cover. But covering with clothing is a better method of protection than sunscreen. So as long as it's closely woven enough. Okay. So the UPF is a good objective measure, I suppose, of
okay. So
whether
you can look on that. You can look on the clothes
exactly,
to see
and
if it has the UPF.
Yeah,
rate.
and for clothing that don't have that, like I said, if you hold it up to the light, you shouldn't be able to see through it.
Okay, and that's a really good tip. So then we've got it's slip-on clothing, and the next one we have is slap-on broad spectrum.
Yeah, so slap on a broad spectrum sunscreen. So broad spectrum means that it provides protection from both UVA and UVB rays. So that's really important because I suppose UVB rays are primarily responsible for burning and UVA rays are primarily responsible for skin aging. But both of them contribute to DNA damage, which is what causes you to develop cancer. So it's very important that the sunscreen that you're wearing provides protection from both of those. So you need an SPF of at least 30, so 30 plus for adults and 50 plus for children. And what you want is a UVA rating of 4 stars or more. So 5 stars ideally, but at least 4 stars. And sometimes they don't use stars to describe the UVA rating. So what you'll see is PA and there'll be a number of pluses after it. So what you want to see there is PA plus, 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 plus. So 4 pluses after the PA.
And is there one type or make or brand of sun cream that people recommend? Like, is there, sometimes you see really expensive ones. Is that better than the cheaper one that you get in some of the supermarkets, maybe?
No. So I suppose the key thing with the sunscreen is that it's broad spectrum. So you have your UVA and your UVB protection. You have your SPF of 30 plus for adults or 50 plus for children. And you have your high UVA star rating. So it doesn't matter if you buy your sunscreen, from an own brand supermarket chain, or if you buy a high-end cosmetic sunscreen. both of those will do the job if they have those key elements.
Oh, that's really good to know, actually, because you just assume because something is expensive that, that must be better. It must have more protection, but it's not.
No,
that
so
at
that's
all.
no, it's not necessarily the case at all. No.
And is there I was thinking about this, when people put on sun cream and they can't reach their back, is there particular areas of the body that are more susceptible, I suppose, to the sun, or that we forget to put sun cream on?
Yeah, so I suppose it's not that they're more susceptible, but that's a good example. So the likes of the back, because it's hard to reach, or, somebody might kind of get halfway down their back. And so the back is one. But I suppose the key thing you need to do is, I suppose I've already mentioned it, but it's worth reiterating. The clothing is the key method of protection. And then you're applying sunscreen to the areas that are not covered by clothing. So ideally, the likes of your back, you would just cover it by clothing. If you can't do that for whatever reason, then, you need to apply the sunscreen. But the research will show actually that most people don't apply enough sunscreen. So for the average size adult, you should apply around 30 mils of sunscreen to your whole body. So that works out, it's 7 teaspoons of sunscreen.
Okay.
So a teaspoon for each arm, a teaspoon for each leg, a teaspoon for the front of your torso or chest, a teaspoon for your back, and one for your head and neck. So I suppose another way.
I've never heard that before. Actually, that's a really good. That's a really good way of putting it, because you wouldn't think about that. Sorry, Bernie, was there?
Yeah, there are also relevant points that you have to make in relation to applying, because I'm often asked that as well, kind of how much that people do not know, kind of like how much to put in. But I think it's to bear in mind that no sunscreen will give you 100%. That's why Doctor was saying here, like, you know what I mean? The clothing is your best protection. Like, depending like on what you do, you're doing kind of like that. If you're out, like you're sweating like that it has to be reapplied.
Yeah, the reapplication.
Yeah.
And what is it about Irish people that when they go on their holidays or they go abroad, they have every sun cream under the sun, but in Ireland, they just don't think they need to wear it?
So yeah, it's quite a common misconception that you don't need to protect your skin from the sun in Ireland. So this idea that Irish sun isn't real sun. But from April to September, ultraviolet radiation, which causes damage to your skin, is strong enough to cause DNA damage and increase your risk of skin cancer. So it's important that for those 6 months from April to September, that you follow the SunSmart 5 S's and protect your skin from the sun's radiation.
Okay. And so the next one then is slap on a wide brim hat.
Yeah. So again, along the theme of covering your skin as much as possible, you need to wear a wide brim, so a Legionnaire's or bucket style hat, because things like sun visors and baseball hats, they don't provide enough coverage for your face and your neck.
Yeah, and I think with we'll talk about a little bit later the program that you have in schools, but kids are wearing the bucket hats and they're a bit trendy now as well.
Yeah.
Yeah. So seek shade is our next one then?
Yeah, so it's very important, particularly between the hours of 11 and 3, when the sun's UV rays are at their strongest, to take cover and seek shade and to keep babies and young children out of the sun completely.
Yeah. And the last one then we have is slide on the sunglasses, which I think is an interesting one, because you don't think that your eyes will get harmed by the sun.
So a lot of people aren't aware that UV radiation can also damage your eyesight, and it can cause problems like cataracts. So it's very important to slide on your sunglasses. It's also important to remember that the darkness of the lenses, that doesn't indicate how good the protection is. So you should choose sunglasses that provide 100% UV protection, and they carry the CE mark. And usually they'll be marked with UV 400. That's what indicates that they provide 100% UV protection.
So there's all recommendations. And if anybody's wanted specifically to get information about everything that you've said there, like there's so many different things, UVA, UVB, SPF, there's a lot of information there. Where would they go for that type of information?
Yeah. So if you visit HSE.ie/SunSmart, or check out #SunSmart on social media, you'll be able to get lots more information there.
Okay, that's great. And we've only started doing this campaign 5 years ago, but I think, is it Australia that has been, that have a campaign, something like this for about 30 years? And has it made any difference really?
Yeah, so I suppose we're very lucky that we can look in the international context to Australia, because, as you said, they have had this campaign in place for several decades. And like ourselves, a lot of people that live in Ireland are fair skinned, they've light coloured eyes, they've red or blonde hair. And while everybody is at risk from sun exposure and anyone can develop skin cancer, people who are fair skinned are at increased risk. And there are a lot of fair skinned people living in Australia also. So what's great is that we can look to their campaign and we can see that over the 30 years that SunSmart has been in place in Australia, they've really been successful in reducing their levels of skin cancer. Like, they had one of the highest levels of skin cancer in the world at one time. And also, I think what's important is that in Australia, the SunSmart campaign has really embedded sun protection into the culture. So in Australia, people don't think twice about applying their sunscreen. People don't leave the house without applying their sunscreen. So that's what we're hoping to emulate here in Ireland. So what we want here in Ireland is that when people are going outside every day from April to September, it will just be part of their routine. They'll do it on autopilot. They'll put on their sunscreen and off they go.
Yeah. And Bernie, you've been campaigning for this type of thing, I suppose, since 2008. Can you see a difference? Are we making an impact here on the culture of it all?
I would say absolutely we are.
Good.
When I go back to 2008, to now, people are they're more aware, for sure. And as I say, the information now that's available, as Dr. Breda said there, you get onto the HSE, SunSmart, it gives you all the guidelines that we need for family for all ages. They're simple guidelines, but they do make a difference.
Yeah. The other thing is, Breda, we know that the sun damages the skin and we have the problems with skin cancer, but it can also age the skin. And when you see all this information and all this upsurge in cosmetic surgery, and half of me is thinking, well, if people just protected their skin from the sun, they might need as much cosmetic surgery. Now, that might be very naive on my part.
Yeah, so absolutely. So exposure to UV radiation from the sun, but also from sunbeds, which is very important to mention, is probably the single biggest factor really in skin aging. So one of the most important things that you can do to prevent premature aging of your skin is to protect your skin from the sun.
So you mentioned sunbeds there, Breda, and I still can't believe that we have sunbed shops, if you like. I know that sunbeds now are banned for people who are under 18, but can you tell the listeners the damage that the sunbeds can do? And anecdotally, I've heard it's a lot of young men are using sunbeds. Which is mind-blowing because they don't use the fake tans. So they're using the sunbeds before they go on holidays, before they go out in the football pitch or whatever. And that's just incredible to me.
Yeah, so traditionally, I suppose we would have thought of sunbed use as a kind of a female-dominated sort of a thing. But we are seeing that a lot more young men are using sunbeds now. And I suppose it's a very concerning trend, really, because sunbeds emit UV radiation in the same way that the sun does. And I think what they say is, within Europe anyway, the sunbeds typically, they emit similar radiation to midday tropical sun. So you can imagine that's very strong UV radiation. So there are no benefits to going on a sunbed. I suppose it's particularly important for younger people because if you start to use sunbeds before you're 35 years old, you increase your risk of developing melanoma skin cancer by 75%.
75%?
Yeah, which is enormous. But regardless of your age, there's always increased risk in, one sunbed session is enough to significantly increase your risk of skin cancer.
Oh my goodness. Yeah.
Now, I do know, and I have to come in on that because like that, sunbeds, and we go back to probably the 2000s and that, when they were very trendy and that, and they did exactly what Dr. Breda said there, you got a base tan before you went on your holidays, and I know, because I know from the sisters, Sharon's sisters, Sharon did take some of those base tan before she went on holidays. Now, did that kind of, accelerate the melanoma? That's possible.
Yeah.
But I do know she did take a couple of those sunbeds.
So what would you say to people?
I would certainly say cut out the sunbeds, most definitely. They are lethal. We know what Dr. Breda said there, kind of, they emit double the sun exposure,
So the intensity of them is just so. And just to think that young men are using them, and I guess they're using them because they want to get the tan and they want to look like they've been on their holidays or get before they go on their holidays. But that is alarming.
But you see, what we have is the old cliche, oh, that colour looks fabulous on you.
Yeah.
And because you look so good. And the whole rationalization of it is that, the skin is trying to protect itself,
Yeah.
so there's no such thing as a safe tan.
Yeah. And Breda, what are the steps that people should take to get regular skin checks, or what should they look out for?
Yeah, so I suppose there's a number of things that you should watch out for. So one of them is if you have any existing moles, so any changes in those moles. So we're talking about things like a change in size, a change in colour, if moles are bleeding or if they're persistently itchy. Second thing to watch out for is any new moles or any new lesions on your skin that weren't there before. Now it is normal to develop new moles up to the age of 35, so it doesn't always mean that there's a problem. But if you see a new one, you should 100% get it checked out just to be sure.
Who checks it out for you? Do you go to?
So you would go to your GP.
Okay.
So, and I suppose the third thing is if you have any red spots or areas of skin damage that are not healing.
Okay.
That's the third thing that you should watch out for. So if anybody has any of those types of changes in their skin, they should just pop into their GP just to get checked out.
Okay. And if the GP was worried or if they thought there was something, what happens then?
Yeah. So if the GP is concerned that you might have a melanoma, which, as we've said, is the most serious type of skin cancer, they have what we call rapid access pigmented lesion clinics.
Okay.
So they'll refer you to one of those clinics. And then a dermatologist will check out the skin lesion there.
Great. So an expert will see it, maybe take a biopsy or give a very educated view on what it is.
Yeah, I just want to say there, just to pick up on that, and can I say early detection is vital. As Dr. Breda said there, like if you notice any new moles or any like lesions there that's not healing or that, just go and get it checked up. As I say, early detection can save lives.
Yeah. Absolutely. Thank you, Bernie, for that. Because now the other thing is tannin injections. I can't get over this. So there's tannin injections, there's a nasal spray, there's gummies. I mean, I don't know, but this is all new to me. Obviously, I've heard about the injections, but the nasal spray and the gummies and everything else, I flabbergasted with it.
Yeah, so I suppose it's a very concerning development, really, because. And I think what a lot of people may not be aware of is the fact that those products are completely unregulated. So there is no legitimate or legal source whereby you can get those products. So if you see them for sale, they are illegal and they are unregulated. And I suppose anything.
So there could be anything in them.
Anything.
You don't know what's in them.
Absolutely. Yeah. Because when medicines or any products that are for sale, even cosmetic products, when they're regulated, they have to be manufactured under certain standards, and we know exactly then what's in them and how they're made and so on. And also they're followed up in terms of long-term side effects and so on. But when you have an unregulated, unlicensed product, you don't have any of that protection, you have none of that certainty. And what we do know is that there are multiple side effects listed in terms of nausea, vomiting, kidney problems. And I suppose even from the cosmetic side of things, they can actually cause unwanted pigmentation as well, because how they work is they stimulate your skin cells to produce more melanin. So melanin is the pigment in our skin. So when you do, if you are exposed to the sun and your sun darkens in the skin, that's due to melanin. So what these drugs do is they stimulate your skin cells to produce more melanin, and therefore obviously your skin gets darker. But what can also happen is existing moles can become darker, or you can have areas of pigmentation. You're not necessarily going to get a uniform. So even putting aside the health concerns, from a cosmetic point of view, you can also get undesirable effects from them.
Just as you're talking there, Breda, I'm wondering, so would it be practice that people would have one of those injections or take one of those injections or the gummies and then go on the sunbed or then go on holidays? Is that what's happening?
Absolutely, yeah. So that's commonly how they're used. So people purchase those and then they use them either in conjunction with their sunbed sessions or before they go on their holidays, in order to, I suppose, augment or increase their reaction of their skin to the UV radiation. So it's extremely dangerous.
And Breda, how are we regulating sunbeds? How do we know that under 18s aren't using them? Or how is there any way? What are we doing about this new drug that's tannin drug that's coming in?
We have strict regulation and legislation in terms of sunbeds, and what happens on the ground in terms of enforcing that legislation is our colleagues in environmental health. They would perform inspections at various sunbed premises around the country. So they're doing a great job of, ensuring that the legislation is followed. Now, having said that, it's challenging. They can't be at every sunbed premises in the country every minute of every day. So we do know anecdotally that unfortunately people who are under 18 are using sunbeds. But having said that, our colleagues in environmental health are doing a great job with the enforcement.
They police it and
absolutely.
enforce it, yeah.
In terms of the regulation of the melanotan, it isn't regulated in Ireland. So the HPRA, which is the Health Products Regulatory Authority, so that's the body they're responsible for regulating medicines in Ireland. They don't stand over melanotan, so that their position is that it shouldn't be used. It's unsafe.
So do all of these products have the same effect then, Breda?
Yeah, so there's various methods of delivering the drug. So as you said, there's the gummies, there's the nasal sprays, there's the injections, but the end effect is the same. So all of them stimulate your skin cells to produce more melanin. So all of them are dangerous and all of them are unregulated. And I think it's worth emphasising again that there is no legal source for these drugs. So when you see them, they're mostly sold actually through social media. So if you see them advertised, you can be sure that they're being imported into the country illegally.
Okay.
So there's no legitimate source for these drugs. So they're not safe to purchase under any circumstances.
So if people see them online, they think, oh, well, they don't even think about the regulation. They think, oh, well, if you can get them, they must be fine.
Exactly, yeah. But no, they're not.
Yeah. That's awful, really. And there's a lot of work to be done on that, I guess, as well as part of this to just inform people.
Well, raising awareness is key.
Yeah. And that's what you keep saying, Bernie. It's all about raising awareness, letting giving people all the information. Yeah,
absolutely.
So there's a few other things that I think we should talk about today, just to mention the amount of work that's going on behind the scenes, because you have all of these different areas of work. It's part of the bigger picture of the SunSmart campaign, but it's not the 5 S's. So you have things like the children's art competition, the SunSmart toolbox. So maybe I think in particular the SunSmart toolbox for outdoor workers. That's a really interesting one because again, outdoor workers very often can be men working on construction, working in farming, working in all these different areas, and trying to convince them to wear the sun cream and wear the hats. I'm sure that's not an easy one either.
Yeah, absolutely. So we'd consider that one of our key initiatives because outdoor workers are one of the groups that are at increased risk of developing skin cancer because, as you've said, first of all, they have a lot of UV exposure because they're outside, a lot of the time through their job. They can't avoid it. And then secondly, they tend to be maybe less aware, or they tend to be a group of people that are less likely. Like traditionally, I suppose, people who are out farming or on building sites or whatever, putting on sunscreen wouldn't have been part of their day-to-day routine. It wouldn't have been something that would have occurred to them.
I've often heard the term the farmer's tan. You have a farmer's tan. So I mean, it's been there forever,
Yeah, exactly. And then I suppose these people have years of exposure that leads to cumulative damage. So over time, they're at significantly increased risk of developing
So what kind of
cancer.
things have you been doing then to implement this?
Yeah, so I suppose we've worked with multiple organisations, for example, on Post, Teagasc, Irish Fisheries, in terms of raising awareness amongst their employees about, things like wearing hats outside, using sunscreen, using sunglasses, all the components of the SunSmart 5 S's, but the importance of incorporating them into their workday.
Very good. So you targeted that group of people to really, really try and make an impact with them because they're high risk,
they're particularly high risk.
Yeah. And you've got things as well like in the junior cycle, you've got the SunSmart activity, and you've also got the children's art competition. And I know, Bernie, you said that when you used to work in a creche or a play school, the importance of getting the kids to get used to putting on the sunscreen at a very early age.
Absolutely. And I find that it is so important kind of, at a very young age to teach them. I mean, I say like life skills, we teach them like how to cross a road safely. We teach them how to wash their hands. We teach them how to wash their teeth. We teach them how to wash their faces and why not, teach them how to be sun safe.
Yeah.
And it can be so simple, just like that, as I say, when I was in a creche and we had a picture of the seasons and we would talk about, well, what would we put on now when the sun is out? And they would say, like, the sunscreen, put on our hats, put on our, cover our tops. We'd put on a top and put on our long trousers and whatnot. And these are all light basic things, but they were learning all the time. And they say, like, if you teach them early enough, they'll continue on, they'll adopt it later in life,
Yeah, and I think there's a lot of work going on with creches and with schools as well in relation to the SunSmart campaign, isn't there?
There is, yeah. And in terms of skin cancer risk, childhood is a really key period. So children are particularly vulnerable to UV damage skin damage from UV radiation and sunburn. So severe sunburn in children. So if you've had 3 or more episodes before you're 20 years old, it increases your risk by 2 to 4 times of developing melanoma over your lifetime. So it's really, really important that children are protected from the sun. And also, as Bernie was saying, it's that embedding it into the culture that when these children grow up, it's just going to be second nature to them because, from a young age, they've been doing it and it's been part of their day-to-day routine, and they won't think twice as adults then about taking their daily skin protective measures, covering their skin, wearing their sunscreen.
And like you said, Australia are doing it for the last 30 years. So it's part of their daily routine now, and it's working, and we know it works, which is really, really important. So if anybody wants to get any more information on that, is to go to the HSE SunSmart campaign. And I think any companies who have outdoor workers or any of the things that we've mentioned to you at all, they can go to SunSmart and then get more information and get in touch with you about that. And Bernie, one of the things I just wanted to ask you about, because I know the National Cancer Control Programme are always looking for people to be public representatives, not just for the SunSmart campaign, but for all the different cancer campaigns that there are in relation to that awful disease of cancer. How have you found your work as a patient rep? Is it a patient rep? Is that the right thing to call you, I guess?
Yeah, I suppose.
Or public.
Well, of course, the whole thing is it's because of the personal experience, that we have had as a family, and to be able to go and give people, information, that we have, or I have gained, over the years, I find it very rewarding, and it can, as I say, you don't know who you're giving this information to may pick up on it, and I always find at the end of the day, we give out, and I give out, what I know, what information I feel like it, and it is up to people to take that up.
Yeah, so you're just informing people. And if any of our listeners are wanting to get in touch with the National Cancer Control Programme's Patient Engagement Manager, you can do that at info@cancercontrol.ie, and the contact there is Dorothy, and she'd be delighted to hear from you. If there was anything to do, it doesn't have to be just around skin cancer, it can be any of the cancers, and particularly people with personal experience, because their experience is really what informs all of these campaigns, and their work is so valuable, as yours is, Bernie. I mean, it's just incredible what you've been doing. Then I think that, Breda, what would you say to people though? What is our kind of, before we finish, what are our key messages then for the public?
So I think the key message is that between April and September, the levels of UV radiation in Ireland are strong enough to damage your skin and increase your risk of skin cancer. So it's really important that you protect your skin every day by following the SunSmart 5 S's of slip on clothing, slap on a broad spectrum sunscreen, slap on a wide brimmed hat, seek shade, and slide on sunglasses. Don't deliberately try to get a suntan, avoid being sunburned, and never ever use a sunbed.
Okay. And Bernie, for you then, what would be your advice with your experience?
Well, there was always one line I always used, and I'm sure you will agree with this, that life is fragile, so you treat it with care. And so it is with our skin. It's the largest organ in our body, and sometimes we can subject it to, unfair things like that UV exposure and that. But I'd say to people, look, be your own advocate. Get online there, find out what you need to know for yourself, for your families, for whoever wants to take in that information that you can give them, and enjoy your summer and have a safe and a healthy one.
Yeah, and the other thing that just comes to my mind before we finish up is to if you do notice any changes in your skin, go and seek help, that there is help out there. Go to your GP, get them to check out any changes in your skin, any markings or anything like that. And it's great to hear that there is that access access facility if they do notice anything different. So I'd like to say thank you so much, Breda. Thank you very much for joining us. And to Bernie especially, thank you so much for joining us today and telling your story. I think that's what makes the difference, that people, the work that you're doing and the effort that you put into it and the passion that you have for this on behalf of your daughter Sharon is commendable. It really is. And I'm so delighted to have met you today. I really am. So I'd like to say thank you very much to all of our listeners. If you think this would help anybody, please send this podcast on to your colleague or your friends or family. This has been the HSE Talking Health and Wellbeing podcast, and thank you for listening.